Hey, Dr. Kurt Steele here again. Thank you for visiting my website. I want to talk a little bit about my on-site transformation services. The last one I did, Minnesota, Dr. Amy Rutzer, I don't think she'll mind me mentioning her name because I find this humorous. She came out to help me carry my stuff, and she said, "Well, where's your stuff?" And I said, "Actually, it's my stuff's right here." And what I mean by that is, we've had 2 or 3 consultants come to my practice over the last 30 years, and the one thing that I even found a tad discouraging is they all have the same exact program for every practice. And every practice is so unique. If you went to my 8 or 9 on-site transformations I've done so far, none of them look the same because every practice is unique. I've gone to practices where they're seeing 50 patients a day, trying to do 23 exams a day, and the revenue per exam is terrible. And then I've been to practices where they need more patients. Well, you can't teach those 2 practices the same program. They don't need the same thing. So what I do in my on-site transformation, first of all, I do a survey of your team before we ever get there, and I have you send me your numbers so I can look at what metrics need the most work. But it's amazing. First of all, you have a great team. I always hear, if I only had a better team. I hear over and over again in my travels that staffing is the #1 pain point or issue in a private practice. And I'm here to tell you, you have a team. It's just putting the systems and processes in place and making sure they're happy. Making your team a happy team is the key to having a great team. So I always survey them and I ask them a few questions. But one of them is, what would make that a great place to work? What are some of the things that are getting in your way on a day-to-day basis that are holding you back? And when I come in on day 1 and we fix those things, watch them light up. It's an amazing transformation, and it's going to be key to growing that big time practice that you want. So day 2 is more about what we want. We give them what they want day 1. I've done everything from move front desk to remodel a waiting area. We've cleaned a storage room and made it an operator room. It's amazing what the team knows will make your practice run better, and it works, and it really works. Then day 2, we work on what in the numbers say that you need. So we transform the team culture, and we transform 2 or 3 of the numbers that you really need to work on to make that practice financially successful. Now, the first 30 days are crucial. That's what I call Death Valley days. Those are the days where things can fall apart and it's easy to go back. So the first 4 weeks, I'm going to be calling once a week. And then do it. If you want to just do it with doctors, that's fine. We can do it virtually with your entire team. We got to make sure everybody stays on the same page. The second month, we're probably going to do at least 2 calls. We need to do 4. We'll do them. Then the third month, try to go where we can just do 1 call. Now, here's another thing where I'm a little unique, is at the end of the third month, I'm coming back. Most consultants, they come in, you get a day or 2, then you might get a couple of phone calls, but other than that, they're gone. I'm not gone. I'm going to come back. And at the end of 3 months, what I hope happens is it's a celebration. I come back and we just have a party because we have done so well. If we still got more work to do, then just according to your needs, we just extend the process. I definitely don't think I should be coming more than 12 months. I think that's the absolute maximum. If I haven't gotten you transformed within a year, then shame on me. But I guarantee you that's not going to happen. So I really enjoy this. I have a passion for independent optometry, staying independent. So if you're ready to grow that multi-million-dollar practice, build a legacy that's going to be here for generations to come, give me a call. Let's do that discovery call. Let's see where you're at, and let's get to work. Dr. Kurt Steele here. I appreciate your time.